You are weakening your third eye every day. That is not an accusation. It's an observation you can test for yourself, right now. There is a faculty of inner seeing, call it the third eye, inner perception, or the gaze of memory, that lives in the body as much as it lives in the mind. Small, repeated habits erode its sensitivity. I'm going to show you a simple somatic verification you can perform alone, explain why this happens according to a very old set of texts, and teach a short nightly activation to begin restoring that sensitivity. Before we begin, a short note. What follows is experiential and spiritual guidance, not medical advice. If you feel anything uncomfortable at any time, stop and breathe, press gently, never force or strain. Settle into a chair where you won't be disturbed for a few minutes. Let your feet touch the floor. Soften your jaw. Inhale slowly for 3 counts. Hold 1, and exhale fully. I want you to prepare for a quick physical check that scholars of ancient texts would have recognized as a way to confirm inner recollection. This will be the first proof, a tiny, deliberate act to see whether something inside you still remembers. Rest the fingers of your dominant hand along the outside edge of your palm, near the base of your little finger. Move your hand now, slowly, to the side of your hand. Trace, with light pressure, a single line from the wrist toward the base of the thumb, feeling the skin and soft tissues. This lateral line, in a centuries-old language, corresponds to a mark of perception. In modern terms, we map that same mark to what people call the third eye. Not strictly the gland in the skull, but the faculty that discerns interiorly. If anything shifts, a small warmth, a pulsing, a sense of attention focusing inwards, notice it without interpretation. You might feel nothing at all, and that is fine. If you do perceive a change, type the word recognition in the comments so others know they are not alone. Stay with your breath for another slow inhale and exhale. We'll return to a fuller check in a bit. Why start here with touch when many teachings speak only in symbols? Because many ancient traditions, including the writings found at Nag Hammadi, treat the body as an archive. It carries seals, marks, and places of memory. The Gospel of Philip, preserved among the Nag Hammadi texts, describes signs on the body that mark an interior lineage, a way of remembering source. I do not present this as canonical gospel for all Christians, but as a set of Gnostic images and practices recovered from a different stream of early spiritual thought. Read as metaphor and as method, these images offer a practical map, a source, a system that obscures and places on the body where remembrance can be checked. In that map, the ultimate source is sometimes called the monad, the singular origin of consciousness, the spark from which the inner light emerges. Opposite that is the demiurge, a name given to the architect of the visible controlling system. Between you and your recollection stand what the texts call the archons, agents, patterns, and frequencies that distract and fragment attention. In our language today, the archons are the forces that capture your gaze and scatter your attention. Incessant feeds, bright notifications, the habit of processing several tasks at once until your attention thins into a soup of impressions. The Gospel of Philip and related Nag Hammadi materials also speak of 3 marks, 3 bodily nodal points that indicate where memory is lodged or where recognition can be verified. I will translate that ancient architecture into a practical, modern practice. Think of these 3 marks as checkpoints for the inner faculty we call the third eye. The first mark sits at the base of the skull, where neck meets head. It is the origin marker, the point that anchors remembrance to your spine and your rootedness. The second mark runs along the lateral line of the hand, from wrist toward the thumb base. The tradition associates this line with perception and second sight. This is the one I ask you to think of as the third eye analog, an external locus that mirrors inward seeing. The third mark rests at the center of the upper chest, a place of command and settled authority, where intention settles and choices are enacted. These are not diagnoses. They are not substitutes for medical or psychological evaluation. They are places on the body where, through gentle touch and attention, you can test whether some interior coherence returns. They are, in effect, somatic questions you can put to yourself. Is there presence here? Is there recognition there? Now, before we go into the full step-by-step check, let me describe the modern condition that weakens this faculty. Imagine your attention as a candle flame. Every time you glance at a notification, flick the toggle on a screen, chase a new habit of stimulation, or let sleep become interrupted, you blow at that flame. Over time, the flame's flame height lowers. The archons, in their contemporary form, are the companies, devices, routines, and reflexes that monetize distraction. They do not have to be malevolent agents with faces. Their operation is simple and systemic. Capture attention, fragment it, keep it returning. Overstimulation, sleep debt, constant partial attention, emotional reactivity amplified by social comparison, these act like friction against recollection. They do not destroy the third eye, but they dampen its sensitivity. There are also subtler, internal archons, the habitual skeptic that dismisses interior signal as wishful thinking, the voice that says, "This is imaginary," the moment you feel something subtle. That voice is actually a sign that the system has noticed you noticing. It will speak. When it speaks, do not make it the judge. Treat it like noise from another room. Acknowledge it, then return attention to the body. If you're ready, we'll do the full somatic verification. Remember the earlier quick check you did on the lateral hand? Now we will locate and gently explore all 3 marks. Move slowly between each step. Breathe in for 3 counts. Hold 1. Exhale fully each time before you touch. Step 1. The base of the skull. The origin point. Sit upright but relaxed. Bring both hands behind your head. Let the weight of your hands be light. Place your fingertips along the uppermost edge where the neck meets the skull. Find the soft hollow right under the skull. Rest there with minimal pressure. Breathe once as instructed. Inhale 3, hold 1. Exhale. Keep your attention anchored to the base of your skull. You may notice a subtle warmth, a settling sensation, or a faint tingling. You may feel nothing. That is normal. Allow whatever is present to be present without demanding proof. Stay here for about 30 seconds. If any thought interrupts, "This feels silly," nothing is happening. Notice the thought, label it if you like as thought, and gently return to the touch. Step 2. The lateral hand, the mark of perception. Place your dominant hand to the side of your other hand, then trace the lateral line from the wrist toward the base of the thumb, with gentle, single pressure. You are not trying to find a sore muscle. You are seeking the place where attention's edge seems to sharpen. Before you touch, breathe. Inhale 3, hold 1. Exhale. Lay the fingers lightly along that line and trace once, slowly, as if reading Braille of attention. After tracing, rest your fingers there and hold for 30 seconds. Notice any change in the field of perception. A narrowing of focus, a subtle cooling or warming, a slight uptick in clarity. If you feel a fleeting image, a childhood scent, or a sense of a remembered horizon, treat it as data, an invitation, not proof, and breathe with it. If nothing appears, simply observe the hands, the breath, and the space between inhale and exhale. Many modern practitioners will be surprised that the third eye is mapped to the hand. The point here is not anatomical literalism, but functional analogy. The hand, through its lateral line, can reflect how your system perceives beyond the 5 senses. In the tradition we're drawing from, a mark on the hand is a mirror for inner sight. That mirror may be dusty, and the act of gentle touch is a way to wipe it and see what returns. Step 3. The center of the upper chest, the command center. Place both palms gently on the sternum, fingers pointing upward, thumbs resting near the collarbones. Breathe as before. Keep your touch soft. Press only to the degree that is comfortable. This location is the seat of settled intention, the place that registers whether decision and recollection can converge. Keep this contact for 30 seconds while you breathe slowly. You might sense a calming wave, a steadier heartbeat, or a quieting of mental chatter. Again, no need to force any sensation. If anything feels strained or tight, soften your contact and return to the breath. After you've moved through these 3 checks, base of skull, lateral hand, chest, take a full inhale and exhale. Open your eyes slowly and notice whether the room feels slightly different. Minor shifts are the usual result. If you felt something at all during any of the touches, please type recognition in the comments now. That small public note helps other seekers know this is not only your private curiosity. A few lines about resistance. When a system is used to capturing your attention, it will send countermeasures when you begin to reclaim it. They are predictable. A sarcastic internal voice, an urge to check the phone, an avalanche of trivial thoughts. Recognize these not as a failure of practice, but as a confirmation that something meaningful is happening. The system only cares when you begin to care. Treat those intrusions as a sign. You are being noticed by what once kept you distracted. Now for the activation you can do at night. This is a short, gentle routine designed to preserve and strengthen perception over time. It is not magical, and it is not a guarantee. It is a disciplined hygiene for attention and somatic memory. Begin with a simple posture. Lie on your back or sit comfortably. Dim lights if possible. Breathe deliberately. Inhale for 3, hold 1, exhale fully. Repeat once. Touch the base of your skull with the flat of your fingers. Hold gently for 30 seconds. Breathe with intention, as if inhaling memory itself into the spine. Move your hand to trace the lateral line of your hand once, slowly, and rest there for 30 seconds. Finally, place both hands over the center of your upper chest and press gently, not hard, while you prepare to speak the activation aloud. When your hands are settled on the chest, say these words aloud, clearly and with conviction. I recognize my origin. I activate my perception. I declare my command. Speak them as simple statements of recognition, not as promises to the world. Use the voice in a normal register. This is an affirmation of internal alignment, not a summons. You may repeat the phrase once more if it feels useful. After speaking, rest for a moment and notice the quality of the breath. Observe without demanding a result. Expect inner doubt. When the voice says, "This is imagined," do not engage in argument. Imagine that voice as radio static leaking in from a distant station. Name it distracted mind or habit, and return to the hands, the touch, the breath. Doing this repeatedly is how the field of perception regains coherence. Small acts, repeated, shift the system. To protect what you restore, adopt a few daily habits, practices of attention hygiene. First, limit attention leaks. Designate 2 short windows each day when you check feeds and messages and avoid habitual scrolling outside those windows. Second, cultivate short silences. 10 to 15 minutes in the morning or evening without screens, a time for breath, walking, or stillness. Third, respect sleep. Reduce bright screens before bed. Let an hour of quiet precede rest so recollection has space to consolidate. Fourth, microchecks. Bring the 3 marks into a brief practice. Base of skull, lateral hand, center chest, for 1 to 2 minutes at night. These microchecks are not ritual theater. They are maintenance like oiling a joint so it moves freely. There is more to be said about the social and institutional reasons why such practices were once marginalized. The Nag Hammadi corpus was buried, literally and figuratively, in part because its ideas threatened the order of interpretation and control. When a tradition teaches the individual to verify interiorly, the power of centrally mediated certainty diminishes. That does not make the texts dangerous in a sensational way. It only reveals that spiritual autonomy shifts the balance of who decides what is real. Read these texts as invitations, not as edicts. You might ask, how fast will this change things? Some people notice subtle shifts immediately: a softening of anxiety, a clearer dream, a sharper recall. Others perceive nothing for a while. Both are valid. The point is not to chase an immediate proof, but to cultivate a habit that gradually restores a capacity dulled by daily life. A practical caution about sensations. You may experience warmth, tingling, a slight pulsing, a cooling or a calming sense of focus. You may also experience nothing at all. None of these outcomes is proof of superiority or failure. If you ever feel discomfort, dizziness, or pain, discontinue the practice and consult a qualified professional. Again, this is spiritual and experiential work, not medical treatment. If you found anything at all during the checks, or if this invitation resonates, leave recognition in the comments so others can see they are not alone. Community matters because reclamation is often lonely work made easier when others are also verifying that their inner sight can return. Before we close, a few clarifying reminders. When I speak of the archons and the demiurge, I am using metaphors drawn from Gnostic texts to describe systemic patterns and forces that distract and fragment attention. When I map the lateral hand to the third eye, I am translating an ancient vocabulary into a modern shorthand. Third eye here refers to a faculty of perception, an inward seeing that can be smoothed or dulled by habit. The Gospel of Philip and the Nag Hammadi writings are historical sources for this imagery, but they are not presented here as canonical authority for all readers. Consider them as one stream among many, useful, provocative, and again, experimental. If you are serious about cultivating this faculty, begin with a week of consistent practice. 3 micro-checks each day, morning, midday, and night, each taking 3 to 5 minutes. No pressure, no expectation of dramatic results. Keep a small note in your phone or on paper, one line about what you noticed each day. Over time, a pattern will appear. If the system is resisting, treat resistance itself as data. Where and when does it show up? Which situations scatter you more? That attention to pattern is the work of recovery. We are living in a cultural environment designed to keep attention thin. That is not accidental. It is practical and profitable for systems that rely on constant engagement. Reclaiming your third eye is not an act of rebellion for rebellion's sake. It is the recovery of an organ of discernment so you can live with more clarity, remember more of your own origin, and make decisions from a steadier place. If you want to go deeper, subscribe now. In the next guided session, we will move from verification into gentle strengthening. Movements for the eyes and neck that are safe, breath patterns that support integration, and a longer activation with progressive steps. Subscribe to get that next session and to join a small community of practitioners who are doing the micro-checks and sharing observations. Remember, the process is gradual, humane, and rooted in attention. The archons work in small, accumulating ways. So does recovery. Your third eye does not vanish overnight. It is dimmed by habit. With patient practice, careful attention to the 3 marks, and a few simple changes in daily life, the faculty of inner seeing can be nurtured back into a livelier, steadier presence. Close tonight with one breath, one gentle touch to the chest, and the affirmation once more. I recognize my origin. I activate my perception. I declare my command. Let that be the small promise you make to your own interior life, and then let the work be ordinary, consistent, kind, and steady.